Why was brain tumor nausea misdiagnosed before modern imaging? Imagine experiencing persistent nausea and vomiting, but doctors keep telling you it's just a stomach bug or stress. Before advanced imaging tools like MRI and CT scans, this was often the case for many people with brain tumors. The reason is that early symptoms of brain tumors are usually very subtle and can look just like common illnesses. Nausea and vomiting are very common symptoms that happen for many reasons, from infections to medication side effects, so they weren't automatically linked to brain problems. In the past, doctors relied heavily on physical exams and patient history because they didn't have the technology to see inside the brain. Early on, brain tumors might not cause obvious signs like weakness, seizures, or vision changes. Instead, they might just press on parts of the brain that control balance or cause pressure headaches, which can be mistaken for migraines or dizziness. Because these signs are so vague, doctors often didn't think of a tumor right away. Another challenge was that early neurological signs are often very mild or intermittent. For example, a person might feel a little pressure in their head or notice slight changes in sleep patterns. These subtle clues are easy to overlook or dismiss, especially if there are no clear neurological deficits. Without clear signs, the diagnosis was often delayed or missed entirely. Adding to the confusion, symptoms like nausea and dizziness are common in many illnesses. Patients with brain tumors could be misdiagnosed with vertigo, migraines, or gastrointestinal issues. There are documented cases where patients were treated for these conditions for months or even years before imaging finally revealed a tumor. Before the late 20th century, imaging technology was not widely available. Computed tomography scans started being used in hospitals in the 1970s, and magnetic resonance imaging came later. These tools allowed doctors to actually see the tumor inside the brain, making diagnosis much easier and more accurate. Once imaging became accessible, doctors could identify tumors early, even when symptoms like nausea were the only signs. In addition, primary care doctors often focused on the most obvious symptoms and missed the broader picture. Subtle neurological changes or pressure sensations were sometimes not recorded or recognized as warning signs. This delayed referrals to specialists and the diagnosis of brain tumors. In summary, before modern imaging, diagnosing brain tumors was like trying to find a tiny needle in a haystack. Symptoms like nausea are nonspecific and common, and early signs of tumors are often mild or hidden. Without the ability to visualize the brain directly, many cases were misdiagnosed or overlooked until the tumor grew large enough to cause more obvious problems. The advent of CT and MRI scans transformed brain tumor detection, allowing for earlier diagnosis and better treatment options. This highlights how crucial advanced imaging is for brain health and timely medical intervention. Always remember, if you or someone you know experiences persistent symptoms, seeking medical advice is essential for proper diagnosis and care.